Hello, my name is Mariam. I'm a clinical coder. In this video, I will show my role as a coder by presenting a case for a patient think coded according to Australian classification. First of all, clinical coding is to convert medical terminology of diseases and procedures that written in the patient file into codes using International Classification of Diseases. So this is an example of a patient case. A rugby game player injured in the ankle during the game. The injured player transferred to hospital and his file opened for the admission. In the episode of care, the patient was seen by the doctor, and after investigation, the doctor diagnosed that the patient has closed fracture of ankle. He underwent a procedure of closed reduction of fracture under sedation. Few days, the patient was treated and discharged home. In the patient file, the doctor documents the patient case and some notes related to his case, then send the file to Health Information Administration to code it. I received the file, and my role as a coder is to read patient file and analyze the information that documented by the doctor to extract principal diagnosis, additional diagnosis, and procedures to code it. The skills that help me as a coder for analyzing cases is to be knowing of medical terminology, coding standards, analytical thinking, and communication skills. According to Australian Classification of Diseases ICD-10 AM and ACS injury standards, the principal diagnosis, closed fracture of ankle, S82.88. Additional diagnosis, the external cause, kicked by person W50. Place of occurrence, football field, Y92.30. Activity, rugby game, U50.03. According to Australian Classification of Health Interventions, ACHI, the principal procedure, closed reduction of fracture, 47597-00, Block 1537. Additional procedure: sedation, level 1 emergency. 92515-10 block 1910. These are all codes that extracted from this case, and according to this case we code the diseases and procedures similarly depending on Australian coding standards. The importance of coding used by the competent government agencies to fund healthcare sector. Used to improve the quality of healthcare in hospitals. And used to know the extent of diseases in an area.